think for me it's been great to go especially to the big picture talks. There's been a lot of focus on thinking about malaria elimination and eradication in the big picture stories. So like some of the big themes that have been coming out is universal health coverage and how that is going to be important as we think about going the last mile and eradication, because a lot of times we think about just the drugs but not in the context of universal health coverage. We think about our vaccines and how effective they are, but we don't think in the context of infrastructure and the hospitals and the facilities where these are going to be distributed. So I think I've really enjoyed listening to the talks of how we need to think beyond just our drugs and vaccines and actually think about the context where these are going to be delivered in terms of bringing us closer to malaria eradication and how really important those things are. Yeah.
Delegates from over 69 countries here. Has the eclectic mix of researchers and their thinking been a real additive for you?
I think so. I've had a lot of interaction from people from the greater Mekong region especially. For some reason, I've just not had the opportunity to interact with them in other conferences. So it's been great to listen to all the talks from them on mass drug administration in the greater Mekong region, looking at triple combination therapies, looking at artemisinin resistance in that sense. So I think for me that's been a really special opportunity to interact with people from many countries, but especially the greater Mekong, sub-region, and just listening to their stories, some of the things they're doing really well, some of the challenges that they're facing, and kind of a good cocktail of stories that you don't get to hear in other conferences or in our normal setting. Yeah, so that has been great for me.
And finally, just drug resistance, and
Yep.
obviously that's a huge factor in the Mekong area.
Yep.
What do you take away on that issue? What are the key messages?
I think so far it's not a simple answer fits all from the same talk. So I probably wouldn't have one quick answer for it, but I think there needs to be a refocus on how we're just addressing the whole issue. It was really nice to go to the triple combination therapy talks, trying to see how people are trying to get innovative ways, trying to use different combinations that have not been tried before, or trying to reduce some of the ones that we are using that we're getting a lot more resistance on them. But I think what I get from it, there's going to be a need to think differently and not try to approach it the same way we have, because resistance seems to be building up, and it's going to be a problem if we keep doing things the same way we've done them before. So there's really been an emphasis on trying either get new tools or just repurpose the tools we have and use them very carefully and very wisely to try and answer some of the drug resistance problems. Yeah.